Good evening and welcome to tonight's edition of Fact Sheet live on ETV, live on Facebook, live on all social media handles. We're excited to have you this evening on the show here. If it's not about the facts, we don't discuss them. Tonight we are talking about a very important issue which I believe concerns you, concerns me, concerns everybody. And that has to do with a common name in our homes, our institutions, COVID-19. So far, it looks as if we all agree that compliance to COVID-19 protocols has not been what we expected. But the disease is not also slowing down, especially with the fact that we are having new variants each and every day, and the fact that it spreads faster and far more dangerous than its predecessor, the original COVID-19. Today, we'll discuss COVID-19. We'll discuss why the people are not complying. We'll discuss the preparedness of our medical facilities to handle COVID-19 even as the cases escalate. Tonight, we'll discuss our medical practitioners and the fact that they are being overwhelmed by the disease COVID-19. We'll discuss the fact that a lot of them are being infected by the disease COVID-19. Today, we'll discuss the vaccine and how we are being told that some 2.4 million of these vaccines are expected into the country by March. Distribution. Issues about conspiracy theories about this vaccine and the option to go for AstraZeneca. We'll discuss all these issues live on the show. But what really do you know about COVID-19's new variants, the UK one, the South African one, and several others? What do you know about them? We'll discuss all these. PPEs, a matter of concern to all of us. We'll discuss it and how government is going to fight this disease, regardless of the presence of a vaccine on the market. But just before we start the conversation, let me paint a picture for you. This morning on the Happy Morning Show, whilst we were giving our regular COVID-19 updates, the update that was given was that we had recorded as at this morning 533 deaths, mortality rate, 533. Tonight, if you check the time, it's just 8. We have 542 cases of people who have died as a result of COVID-19. The active cases, as I knew this morning, was not up to 7,850. But now, as we have this conversation, 7,850. Why are the numbers going up? Are we, as a people, not complying because we do not understand the consequences of not complying, or what really is it? Tonight, we'll discuss these and many more live on ETV's Fact Sheet. My name is Samuel Eshun, and I welcome you to the discussion. We'll be right back. You're welcome back to the conversation. This is Fact Sheet live on ETV, live on Facebook, live on Twitter and Instagram as well. You can follow the conversation this evening by going to Facebook and looking for ETV Ghana. That you can join the conversation. Your thoughts, your views, and your comments are very much welcome in our deliberations this evening. But even as we have this conversation, let me share with you just a few facts. And as we speak now, over 3,000 health workers have been infected by the disease COVID-19. In this country, there are 21 approved testing centers across the country. Several medical doctors have been infected by the disease COVID-19, several of them infected by the disease, the people who are supposed to take care of us if we get infected by COVID-19. I've already given you statistics about the number of people who have died and the active cases. And so tonight, we are asking ourselves just simple questions from the perspective of the health professionals. Why are we struggling with the fight against COVID-19? From where they sit, what could be the attributable factors that's led us where we are? My guests to help me do justice to the issue tonight are Mr. Joseph Krampa. He's a public relations officer for the Ghana Registered Nurses and Midwives Association. They have been badly hit by COVID-19. And then Dr. Peter Kojo Quashie, senior researcher, WACCBIP, to discuss these issues. And so I will start a conversation with Mr. Quashie, Dr. Quashie, and pick his thoughts as to the rate at which the disease is spreading and the number of active cases we have now and the deaths we are recording. Doc, it's good to have you in the studio again.
Good evening. It's good to be here.
I trust you're well.
Yes, I am. I hope you are too.
I'm doing well. I'm doing well. Just fear everywhere because we are all concerned about COVID-19 and we are always being told there's a new variant and it's faster and far more dangerous. But from where you sit as a researcher, what do you make of the numbers? Because the numbers do not just represent numbers, they represent human beings.
Yes. So as a researcher, I mean, the numbers are quite disturbing, but I would say that they are not unexpected, because if you look in terms of society, in terms of the period of the year that we are in, we just finished Christmas. There was a lot of festivities, and unfortunately, fortunately because prior to now, we have had a very mild experience of COVID-19 in Ghana. So because of that, we were quite lax during the Christmas period. There were a lot of people coming in the country. There was a lot of festivities going on. And that is what has led to the current situation that we have here. Somewhere along the line, one of the new variants was able to come into the country, and we believe that is what is really leading to the increased cases that we are seeing. It doesn't mean we have much more cases than before. It's just that now the cases are very severe and people are going to the hospital, and so those are being reflected in our numbers.
Well, we always hear the doctor saying that the new cases we are recording at our facilities are very severe. What do you mean when we say severe? Because the COVID-19, the novel COVID-19, was also very severe.
So if you remember the last time I came here, we were talking about the second wave and whether there was a second wave. And at that time, most of the cases that we get in Ghana were asymptomatic. So people were sick, they didn't know that they were sick, and they didn't look sick, but they were asymptomatic carriers. And we had a low number of cases because of that, because people were not going to hospital. Now, the difference is when you get infected, there's a higher chance that you are going to get symptoms. You are going to start coughing, you are going to start sneezing. And in certain cases, you have body pains, you have shortness of breath, and now this is happening at a much higher rate. So initially when, let's say during the lockdown, we had our facilities full, but about 90% of those people were not sick. They did not present any symptoms. They had just tested positive for the virus. Now if you go to those treatment centers, people are coughing, people are sick, everyone has to wear a mask. So it's a very different scenario. And whereas it used to be you're positive, you resolve, now within 2-3 days they need oxygen. So it's a much different scenario.
So for those of you in the medical field, when you talk about a new variant, what characterizes this strain from the original strain? What characterizes it?
Okay, so with viruses, right, we are making, as the virus replicates or grows, it makes variants all the time. Now, what makes us call a virus a new variant is when it changes how it behaves. So in this case, once it changes how it behaves, we notice that something is different. And when we sequence it, you see that that difference is at the molecular level. You can see that for example, one of the changes for this variant is one part of the building blocks has been shifted for something else. And that's enough to cause it to be more infectious. It allows it to bind to the receptors in the throat much more than the old, you can say the original virus. So just that change, once you start seeing that in more people, then you notice that, okay, this is something we have to take notice of, and that's when it's called a variant of public concern.
But what causes, a virus in its original state to now decide that, let's say, you are using molecular genome and all of those things? Yes. What causes it to decide that, okay, if at this point, it had to detach, let's say, one of its forms in order to now take this shape, in order to cause more havoc. What causes it to behave like that?
So it's in their very nature. What kind of, a virus is such that every time it divides, it changes. So if it divides into 10, all 10 of them, maybe one is similar to the original virus. And most of the time, the other 9, the change is bad for the virus, you know, so you don't ever see it. Now, if the virus changes, let's say you have kids, and then one of your kids is more successful than you, you will notice it, and they'll say, oh, this guy is more successful than the father. And that's the case of the virus. The ones who are not successful, we never hear of them, we never see it. So it's something that's ongoing, it happens all the time, but it's only when that change gives it an advantage over the original one that we see it and that we detect it. So
in the laboratory, you are able to see these things with your gadgets and everything.
Yes.
But in presenting itself in the human being,
yes,
that distinguishing feature, how does it present itself?
So currently, the variant that's spreading in Ghana is a UK variant. And it's about 30 to 40% more infectious than the regular variant. So for example, if before somebody was infected in a household, right? If before you were infected, let's say you have a household of 5 people, one of them is infected. Maximum maybe 2 people within that household will get infected. What we are starting to see with these new variants is that if one person in the household is infected, everybody gets infected. So that's a very significant difference from previously, where, like I said, if 5 people are there, one is infected, maybe one person is infected. Now everybody will show up and be positive for the virus.
But in terms of the symptoms of cough and dryness of the throat and all of that, it's the same?
Those symptoms are there, but we have some more prominent symptoms, which things like body pains, and what we are hearing of more and more is that all of a sudden people have shortness of breath. They might not have had any symptoms prior to that. You know? And these are symptoms that were there before, but they are coming to prominence now with the new variants.
All right, so if you just join the conversation, we are here talking about COVID-19, the approaches we are using as a people to fight this deadly COVID-19, and the new variant or the new strain that is wreaking a lot of havoc in the country. And Doc has been explaining to us the technicalities in terms of what we mean when we say a new strain or a new variant. But Mr. Kwampa is here. They are the forefront of the war. They are the people who witness the fight each and every day when patients are brought to the hospitals and they are in dire conditions and they would have to fight and save them. But in the process of fighting to save these people, they get exposed as well. We have had several from the Volta region, from the Western region, from the Ashanti region, from several other places, how medical professionals at the forefront of the fight against COVID-19 are being infected by the disease. We would want for him to paint a picture for us. The daily activities of a medical professional, be it a nurse, be it a midwife, be it a medical doctor, what they see and how they are being infected, because one would expect that being at the forefront, they will be the most protected. One would expect that from all we hear from the government, that their PPEs are being supplied on a daily basis. The recording of cases of COVID-19 at the level of these medical professionals would be reduced. But that has not been the case. We will talk about medical facilities and the fact that we are being overwhelmed at most of these medical facilities. Let me welcome Mr. Kwampa to the studio and then we begin the conversation. Mr. Kwampa, good evening.
Thank you, brother.
I trust you're doing well.
Yeah, we're doing well.
All right, so you face the battle daily What do you see on the battleground?
Thank you very much. First, may I apologize for being late a bit. There were so many things to do. And Doctor, I'm happy to meet you.
Happy to meet you
We met
too.
on the poster flyer fest. All right, okay. Thank you very much. I think it has been, it's something that is overwhelming. It is affecting us, especially the nurses and the midwives at the forefront. And so many factors are being blamed. At first, when the disease came, the COVID-19, from March to July, for instance, we recorded about 840 nurses having contracted the disease. And then out of which 3 died. And between December and January, December 2020 and January 2021 ending, we've recorded 789 cases for these 2 months. So on the average, the March to July last year was about 210 infection averagely per month. But this one is almost 395 for the 2 months. So it is something serious. And we've delved into so many avenues to find out what is actually happening. And what we observed was that from the reports we are gathering for our various wings in the regions, some were blaming PPEs. Others too were saying that when some of the suspected cases, that is, some were held in the holding centers, when samples and other things are taken, when the results come out, those at those centers are not informed. Well, to me, if you are there and you have to protect yourself, you should. But what I see here is that when they tell you that this person has got the disease, I think you put in some extra care. That aspect is also lacking. And there were places they also blamed, like the nurses have to buy their own face masks, about 2 or 3 in a day. So we recently held a meeting with the government representative and the designated Minister of Health, Honorable, yes, recently. That was on the 12th. When the GMA went, we went the second day. Then we presented this issue. They assured us that at first we all knew that the government was struggling to get the PPEs and other things for the facilities. But later on, saw that the facility were doing their own thing, they were sowing their own, which led to the government relaxing what it was trying to import at first. But having received that complaint means the government should also back up and restock all the facilities so that it will avert the situation where staff are going for their own. What about if you don't have the money to buy? And most people too don't know their rights, whether to leave the workplace or they should also go to work. So we blame that aspect too as part of the thing.
But it's interesting, we're being told this evening that, PPEs are not forthcoming at some of the medical facilities, because the rhetoric we have been hearing consistently is that government has been supplying PPEs to all the medical facilities. Government has been supplying PPEs to the medical facilities. So it comes to me as a surprise that you'd tell us that nurses and midwives at the forefront of the war are buying PPEs themselves. How does that happen? Is it that the administrators of the facilities do not recognize that there comes a time when there's a likelihood of shortage for them to put in requests, or they put in the requests and then the requests are not granted?
Thank you very much.
Which is which?
We considered all these avenues. And what happened was that if we will be fair to each other, getting to the end of the year, it appears we all relaxed. We looked like, it looked like we all thinking because the infection was going down, everything would be okay. So we lost guard. Most people actually did not, that is why the public was, people will be going around without putting all these face masks. People will be there, even campaigns and whatever, the people will just wait without observing the protocols that were laying down. So as the year ended and we started with this new variant also coming in, I think the education is now going on. And this is the time that most members who are complaining that once they thought that the disease was also going down, but with the effect of the rate of increment that is coming in, we need more PPEs. And those PPEs, the government representative also confirmed that they were supplying the facilities at first. But because the management or managers or whatever took over, they have relaxed their own. And once they are receiving these complaints, it means they have to start again. So it means they might have finished, the PPEs might have finished, but with the idea that the disease had also gone down. So the restocking perhaps was not, as before. when this disease actually started in the country, we were all alarmed. And I trust that everybody was observing the protocols. I think that was why we were almost arresting the cases in the country. But having realized that getting to the end of the year 2020, things have gone down, I think this was one of the things that brought up this.
All right, so what we'll do is go for a quick break. When we come back, I'll stay with Mr. Krampa for a while because, Doc, when I come to you, yours is to tell us much more about the disease. Right. But they see it on a daily basis, how it affects them. Whether what we are seeing, it's affecting them, their morale, you know, in fighting. Because, you know, if they go to the hospitals and then the PPEs are not forthcoming, then obviously, if the person hasn't got the money to buy, you know, the PPE, then there's trouble. So we'll go for a very short break. When we come back, I'll stay with Mr. Krampa and then get some details as to how the daily activities of a regular nurse or a regular midwife is, so we can understand where the problems are coming from when it comes to the infection rate. We'll be right back. This is Fact Sheets live on ETV, and tonight we are discussing COVID-19, the new variant. We are discussing the realities on the ground when it comes to those at the forefront of the fight against COVID-19. We are discussing vaccines. We are discussing how to combat COVID-19. And Mr. Krampa has been explaining to us their day-to-day experiences as nurses and midwives at the forefront of the fight against COVID-19. So, Mr. Krampa, I was asking the question before we went for that break as to the story that is in the media that you are being supplied PPEs, and what you are telling us, the PPEs are not coming, and that people have to buy these PPEs. Now, does it affect morale when it comes to the discharge of your duties?
Well, thank you very much. It will definitely affect your morale. Last time I gave an interview and I equated the nurses or the midwives to, let's say, soldiers who are holding weapons to defend the territory of a country. They have the weapons. But even if you have the weapons, you need to get the ammunition to fight the enemy. Our work indirectly is like that. If we are not equipped, we are there, we know the protocols, whatever thing to do to prevent whatever. But if those items that you need to combat the disease are not there, then it will be very difficult for you. We have a word in nursing that we say improvise. And I think that improvisation is the thing that is killing us. It is like you may need this phone and with a pen. That's the proper procedure to do something for a patient. But if the pen is not there and if you have a pencil, you can manage with the pencil and the phone to be able to do that thing. So in the nursing and the midwifery staff, this thing is part of it. Because you cannot say because the pen is not there, I'm allowing my patient to die. No staff is interested to let somebody die in his or her hands. So we do whatever thing we can to help. So in situations, the items or the equipment I may need to do the work are not there, and I don't want this patient also to die, I have to improvise. And that improvisation, the improvise that I will do may also result perhaps in me also catching the disease. So I can tell you that, frankly speaking, the morale is not, it is not very good. It is not very good. And some of them, they also fear to come out with their grievances before their, managers. So in situations like this,
should that not be easy for somebody to complain about?
Oh, like that is what I'm saying. Some may not know their rights. That even if the employer is supposed to, equip you to be able to work, and if those items are not there, you have the right to leave the place if it is dangerous to your health. It's in the labor law. How many of them know this? So some of them, out of sheer ignorance, may want to do something. Even if I don't go to work, they will sack me. These are some of the things. So they end up going. That is why some are buying their own, face masks and others. In the holding centers, we are told it's one of the regions. Even when I come to you at the OPD, we are supposed to use the face mask, do whatever thing we have. But immediately we suspect a case, and we try to isolate that case. There's the different form of PPEs we have to put on when we are coming there. And if we don't have it, and it's the nurse always, who if the patient, somebody is diagnosed, or even before a doctor would even come on at times, for a patient to be diagnosed, the nurse should see the patient first. You take the vital signs, you do everything before you send him to the consulting room. Doctor will diagnose, and then the patient will come back to the ward. Another nurse will receive the patient to the bed. There's not the one. It's not only one person that is nursing. It's nursing so many staff to go around, and perhaps by then the person's status has not been confirmed. You understand? So by the time perhaps symptoms may set in for us to know that this is happening, let's take sample, let's go and do this, let's go and do that. Look at how many people are in the on the ward.
Now, capacity at the facilities. Do you have capacity in terms of space enough with the numbers that we are recording?
Well, I think those who said that no nurse should say there is no bed, I think will be in a proper position to answer this. Because where I had worked, various hospitals, there are situations people will come, you don't have anything, you can't do anything, no bed. You have to nurse the person or accept the person and then put him on the floor just to attend to that person, to save the person's life. But if you say that, oh, there is no bed, then they say the nurses are telling patients that there are no beds. So in capacity-wise, some of these facilities were built, let's say, some years back, and the population as at then too could be looked at. By then, how many, like the prisons that we have, some were built for, let's say, 50 people, but we have about 300 people in one now. So this is the same thing happening in the hospitals.
Do you foresee a situation where our health facilities will be overwhelmed so much, would have nowhere to take cases we record?
It is something. At whole, as I'm talking to you now, the whole, how do you call it, the center is full. And we have members who have been infected. We are communicating with them, the national. We are making everything possible to move them from where they are holding them to a various place. So you can imagine.
In all these, I believe you as health professionals are a bit more, cushioned in terms of packages the government promised that it was going to give you guys. Even if you caught the disease in the line of duty, these packages, are they coming?
That is the problem. We raised this issue, though we went for the vaccines and whatever, but we just put it across. And the government representative actually said that no, they've been paying, but it is not actually going quicker. And we don't know what is holding it back. So all these, and then for the last year, we had some packages like this tax waiver, especially for those who are not in the treatment centers. And those who are in the treatment were also giving 50% in addition to the waivers. But after that period, it seems the government has also waived it again. So it is not forthcoming. And let me use this medium to appeal to the government. The rate at which these things are happening, and for the fact that some of the nurses and midwives are also being exposed, we will pray that they should cushion them again as they used to do, so that they can even get some of the money to buy some of the PPEs if it comes to that. You see, what we are saying now is that the vaccination, it is the community health nurses, the public health nurses who are going to champion this thing. And if they are not well equipped and motivated, and everybody is, as I'm sitting here, had it not been that workshop, or what I call it, the meeting we held with them, I was skeptical about this vaccination until when I went there, what they told us, the questions we have that we're afraid of, they allay my anxiety. And I was able to call my wife to tell my wife that, oh, I think everything is okay. So you can imagine, if even me being afraid, then those are the lower end. So we will plead that they'll see some kind of motivation. They are not being motivated. What they even owe, the government owes them these packages, insurance, those who have caught the infection along the line of duty and whatever. They are not being paid as we thought. And they have also confirmed that it's not going on as speedy as they also want. It's
interesting you brought the issue about vaccination into the conversation. Doc, let me come to you and pick your thoughts on the issue about vaccination. We know how, some conspiracy theorists on social media are spreading, wild news about, the intent of people who are bringing the big pharma and how it's going to make people sterile and all of that. Now, let's begin with AstraZeneca, which Ghana is going for.
Yes.
And then Pfizer's own and some others. Now, the last time I checked, AstraZeneca's efficiency or efficacy was around 86%. Pfizer has around 95-point-something%. And yet, we are going for a drug, which has an efficacy rate of around 86%. Does that not, in the first place, put us in a situation where convincing people to go for the drug becomes problematic?
Well, I'd say that there's a lot of things that you have to consider when you're picking the vaccine. And Pfizer, yes, 95%, but Pfizer needs to be kept at minus 80 degrees. And in Ghana, when you are making these decisions, you have to think about the reality on the ground. Some of the places where you need to vaccinate people, it's very challenging. Even in developed countries, it's very challenging to keep the cold chain. And once a vaccine that is meant to be kept at minus 80 is kept as, let's say, even minus 20 for a certain period of time, that inactivates it. So that's one of the considerations that influences the choice of AstraZeneca. At 80%, it is not as good as 95%, but it's actually still better than most vaccines that are marketed for different things. So it is good enough to vaccinate a large population as long as it remains efficacious.
Now, the theories. One would have expected that by this time, we are in February, today is I think 16th.
Yes.
One would have expected that by now, government would have given us a rollout plan. After all, we're told by the beginning, by March, we would have the first consignment of COVID-19 vaccines coming into the country. We would have a fair idea how government is going to roll out the vaccines. As we speak now, I don't know whether you know the rollout plan of government for these vaccines, if they do come, this 2.4 million vaccines we are talking about. Should that conversation not have started now? Because if you listen to Mr. Kwamba, for instance, being a senior medical officer, he had to get his fears allayed.
Nursing officer.
Yes, at a meeting with government functionaries before he could call his wife to say it's safe. How about me?
So I mean, that's one of the things that we're saying that the government and the Ghana Education Service, Ghana Health Service needs to do. There's not enough education of the public going on, because even in more developed societies, there's a lot of misinformation. So before we even get to rolling out the vaccine, there needs to be a very concerted effort to educate the public, to take away some of these misconceptions and fears of the public, and to remind them that a lot of these falsehood peddlers, they are actually making profits from these. They are what we call clickbait. You go on their websites, they are making revenue from adverts on those websites. You know, so the Ghana Health Service needs to really develop a very effective framework of communicating the message. And there's an infographic I saw in the US where by that time they had vaccinated 29 million people, and they showed 29 million people vaccinated, 0 deaths. 26 million people infected. At that time it was 400,000 deaths. You see, that's a very compelling infographic. It tells you that you have 26 million infections, 400,000 people died. 29 million vaccinations, nobody died. You see, that tells people that these vaccines are safe. Now, you asked another question. Yes, in terms of rollout plan, I know that there has been and there continues to be consultations. There's a task force that has been meeting regularly, and there is a plan that, unfortunately, it hasn't been made public yet, but there is a plan in process for how these things are going to be rolled out. I don't think it's anywhere near ready for prime time, but I know that these consultations are ongoing.
Mr. Kwamba, your colleagues in the profession of nursing, do they know what you know now, which has allayed or disabused your mind about the vaccine?
Thank you very much. Maybe before I go to that, let me top up what Doc also said. What we've seen is that the olden days, let's say, most of these disease burdens were curtailed because of vaccinations, how the people actually responded to it, and others. But of late, I think the world over, people are becoming a bit skeptical about these vaccinations and others. So what we have seen is that those are the forefront, because giving these injections or whatever, vaccinations or immunization, what we want to do, it is the nurses, especially, like I said, the community health nurses, and the government should involve them. One thing with patients is that my doc will just, he will, diagnose the patient, prescribe the drugs. I will be there, let's say 24-hour service with the patient. But though I will close, a nurse will come and continue. So I will be there 24 hours, giving drugs and medicines and whatever, doing other chores for the patient. And if the patient sees me receiving that particular vaccination, he will believe in that vaccination more than somebody else going out there beating gong gong, go and do this, go and do this. So the government should involve the nurses and all those people related, the allies and whatever, so that if he's able to get the nurses and those at the forefront vaccinating, they will be the right people to be able to convince the others. But like I'm saying, as Doc said, how do you call it, is not going out. Education is not going out. It is true that they said they will roll out, they will roll out. When is it coming out? So I will plead that they hasten things up. If actually they are going to start everything in March, then the education should have gone by now. Everybody should have been ready for this. People out there are skeptical.
Are there concerns, are there fears in your fraternity as to the various theories and stories we hear about COVID-19? Are your people having concerns?
Yes, they are. They have it.
What are the concerns?
The concern is that, like you said, some people are peddling false rumors and other things on air. Some will come without source. You wouldn't know. Some people will be told you don't know where they come from. They will profess to be some people. You still don't know them. But as a human being or human society, definitely somebody will be afraid based on what he has heard or seen. So that is why I say, so we all saw some of these things. And having not gotten anybody to explain certain things to me means I have to take what somebody is out there saying.
Let me ask a direct question.
Yeah.
Are your members ready to receive an injection of COVID-19, let's say AstraZeneca, today? If we took stock or delivery of the vaccines today, would your members be ready?
That is what I'm trying to say. Some of them are still skeptical. Until I came here on the 12th to meet with the technical team and other things to talk, I was also skeptical. What we can do is that we should hasten the education to go out. And in hastening it to go out, we should involve the nurses, particularly the community health nurses, the public health nurses, who are going to champion this immunization. It's not everybody in the health sector who can give injection. So definitely we can't rule them out, that they shouldn't be part of it. So the earlier the better. Let's start the education. The technical team bringing out, let's say, whatever thing, wording they want to use, they should bring it out. And they should involve the nurses actively. And for us to be successful at this vaccination, we should be able to, let's say, motivate the people who will be in the front line to be able to discharge their duty and do it very well. Because research from Phasal 2020 that health staff who are afraid of vaccinations actually don't do best. They can't educate people because they themselves are afraid. But if you're able to, talk to them, educate them, and they know the importance and the, let's say, the merits of that particular vaccination they are doing, they will be, patients listen to them more than anything. So if I'm a nurse and I'm afraid of the vaccination, do you think if I go to work, I'll be able to be so proactive I won't be able to do it. But if I understand it, like I said, when I came and heard that, oh, this is what I called my wife back and I said, oh, it is safe. Everybody should be ready. If it is a time that we go to take their distance.
Dr. Quashie, what's the conversation amongst you as doctors as to the issue about the ability of what we are bringing into the country, its capacity to deal with the new strain of COVID-19? From all we have read, AstraZeneca's potency to fight the new variant is not as high as of that of Pfizer. I do not know whether it is even able to deal with the new variant. But the account I have read from, for instance, CNN and Co. tells me AstraZeneca may not be able to fight the new strain. So one would ask, why do we bring it?
Yes, that's the worry that we've been discussing this amongst ourselves. The evidence right now shows that AstraZeneca might not be as good against the new variant. So the UK variant, it might not be as good as the Pfizer and Moderna. We know that, thankfully, so far we haven't detected South African variant yet. We know that it's almost, I don't want to use the word useless against the South African variant, because we've seen that in the South African variant, it still prevents death and serious disease. So the challenge we have here is it's also a buyer's market, right? And Ghana, based on our position in the world, we have to take what we can get. And what we can get right now is the AstraZeneca vaccine. So what that means is that it's even more imperative that we roll this out quickly, because even if its efficacy against the new variant is reduced, there's evidence showing that it still has some efficacy. So if you can roll it out quickly to as much of the population as possible, that small percentage which will not be effective, you can cover it with another vaccine.
It's interesting you're talking about the population, because we are looking at 2.4 million. Even the 2.4 million, what we are actually expecting is less than 400,000.
Yes.
From the last time I checked.
Yes.
So we are not even talking about the millions in the first consignment that is coming.
Yeah, so that's the challenge with what we have right now. And I mean, it's not something I can talk about, but I do have some level of confidence that we will probably get this 2.4 million within the time frame that is suggested. And then, but yes, we will not, I don't believe that we have the capacity and the ability to scale up at the rate that we need to scale up. So we will probably have to have this discussion and conversation at some point, and we'll probably have to be looking at other vaccines. And I mean, even in a lot of the developed countries, we know that vaccination will take more than a year to roll out, and I expect that Ghana will take definitely more than a year. By the time that goes on, we'll have other candidates which will be on the market, and we hope that we would avail ourselves to some of these other vaccines.
We would be best placed to have the conversation we are having now if, for instance, we knew the cases that are reported for Mr. Krampa and his nurses to deal with, the ratio of the old COVID-19 or the original COVID-19 and the new strain. That, for instance, of 10 cases that are reported, 6 of them are the new strain, 4 of them are the old COVID-19. Or let's say 8 of the cases that are recorded of the 10 are the new variants, and then 2 are the original. If 2 are just the original, and we already admit in the studio that AstraZeneca would do nothing, then we are still at where we are. So we would be better placed to understand the issue if we know the ratios.
Yes.
If, for instance, the Ghana Health Service were to tell us that of the numbers we are recording now, the ratio of the new variant to the old original COVID-19, it's, let's say, 60 to 40 or 70 to 30, then it would make sense for us to go for AstraZeneca or to go for any other.
Yeah. So I mean, Ghana Health Service can't have that data, because to have that data, you have to really sequence on a large scale. That's something that we are doing. And to your point, I mean, what the current data that we have is showing that the new variant is driving the current outbreak. So that's a bit disturbing. But like I said, the variant that we have in country right now is the UK variant. So the evidence still suggests that the AstraZeneca vaccine would work against that. Not as good as Pfizer or Moderna, but it will still
minimize.
It will still minimize to a certain high percentage. If we detected the South African variant, then we would be having a completely different conversation, and then what you are saying would be absolutely true. You know, in South Africa, they've stopped vaccinating with AstraZeneca, even though they already have it in country.
All right, Mr. Kwampa, I have just 4 minutes to run up the conversation.
Okay.
I'll give 2 minutes of that time to you.
Thank you.
So that we can run up with the conversation.
Thank you very much. Let me also go after Doctor. At that workshop we attended, we're made to understand that the South Africans actually rejected the Zeneca, because the strain is more. I mean, the level is very high over there. If you compare it to Ghana, it is not as high as this. That is why they rejected it. Before I would come here, I was listening to one of the stations, watching the news, and I think it's Katinka or somebody. And then they've come out to say that, oh no, the drug is good, just that it has its own species, I mean, that it fights against. So we cannot say because South Africa has rejected it, that will automatically Ghana too should reject it. That's not the issue. It will still work and work well. We call something herd immunity. If about, they've targeted about 60%, let's say, of the population, they're able to get them vaccinated against the specific virus, then it means the rest that are there would be safe. We call that herd immunity. So there are so many things being put in place to do this. So I'll urge everybody, if the government rolls out the decision, we should avail ourselves. And for government, we are pleading that the nurses and the midwives who will be at the forefront need to be well prepared, equipped, and motivated to be able to do the work and do it for Mother Ghana.
Let me, sorry, I just want to, the herd immunity, let me give an example. So even if the vaccine doesn't work for everybody, but it works for most people, what that does is it reduces the total number of people who are infected. So let's say in a room of 10, maybe it didn't work for 5 people, but you've already reduced the chance that the other 5 will infect someone. And so that will really reduce the rate of infection.
It's unfortunate that we don't have time, but I remember listening to a conversation on BBC where they were talking about how antibiotics would, in the next 5 years or so, not work again because most of the bacteria and co had become resistant.
Yes.
So that argument you're making about, you know, the herd immunity, could there not also be an underlying danger that, for instance, you vaccinate 5 people in a room of 10. Now 5 gets vaccinated, they interact with, let's say, some of the people there. Is that not a possibility of a new variant also springing out of the 5 who may be resistant to the vaccination you have given to the 5 already?
There's a chance that if the unvaccinated people have a new variant, that can spring up. But then again, you know, with vaccination, it's always you are tweaking it, you are refining it. In this case, because of the rush, the vaccines are what we call monovalent. They are targeting just one point. But usually you have multivalent vaccines. They are targeting multiple points. And so now that we have the new variants coming up, all these companies are now making the multivalent ones. And those, like I said, you first do your blanket vaccination and then you go in and you tweak it. And so those are planned in the works.
I wish we had a lot more time on our hands this evening, but we've exhausted all our time. I'm hoping that maybe we can have one of the mornings on the Happy Morning Show to actually delve deeper into these issues, because, you know, until people are educated about some of the things we are discussing this evening, it will be difficult for us to even have the drugs in the country and for people to accept to even get, you know, vaccinated in the first place. But I'd like to thank you, Dr. Peter Quashie, for making time to join us this evening on Fact Sheet. Mr. Joseph Kwampa, I'm grateful that you also made time to join me this evening on Fact Sheet. And I'm hoping that you, the viewer, and the listener will take steps to also spread the word that, you know, we all need to educate ourselves and protect ourselves from COVID-19 by putting on our nose masks, observing the social distance, washing our hands, and using our hand sanitizers. On that note, I'd like to thank you for being a part of the show this evening. Mr. Joseph Kwampa is the Public Relations Officer for the Ghana Registered Nurses and Midwives Association, and Dr. Peter Kojo Quashie is the Senior Researcher for the WACCBIP. Doc, can you... All right, so they join me this evening to discuss COVID-19, the new variant, vaccines, procurement, and then case management of the disease. I'm grateful you join me. God willing, tomorrow morning at 10 a.m. there will be a repeat broadcast of this show on ETV. So do kindly do make a date and watch it. But I'll be on at exactly 5:30 tomorrow morning for the Happy Morning Show. Maybe we will continue this conversation on the show. I'm grateful once again. Good evening.